In today's video, I'm going to show you how to count contractions and why it's important to do so. Contractions are the tightening and relaxing of the muscles around your uterus that help your baby move down and out of the birth canal. They can feel like cramps, pressure, or waves of pain that start in your back and move to the front of your belly. Your belly will also get hard during contractions and then soften in between. Counting contractions can help you figure out if you are in true labor or false labor and how far along you are in the labor process. This can help you decide when to call your doctor or midwife and when to go to the hospital or birthing center. So how do you count contractions? It's actually very simple. All you need is a timer, a pen, and a paper, or you can also use an app on your phone or a website like the one linked in the description box below to make it easier. Here are the steps to follow. First, start counting as soon as you've had a few contractions. Write down the time so you can keep track of when the contraction started. Second, when a contraction starts, count the number of seconds it lasts. You can use the stopwatch on your phone or an app to do this. When contractions start, they may last about 30 seconds, but get increasingly longer and stronger as labor progresses. Third, note when a new contraction starts. This will tell you how much time has passed between contractions. This is called the frequency of contractions. For example, if your first contraction started at 10 a.m. and your second contraction started at 10:05 a.m., the frequency is 5 minutes. Fourth, keep noting these times for at least an hour to see if there is a pattern and to see if the contractions are getting closer together and longer in duration. This is called the intensity of contractions. Now that you know how to count contractions, let's talk about how to tell the difference between true and false contractions. False contractions, also known as Braxton-Hicks contractions, are irregular, weak, and do not increase in frequency or intensity over time. They may go away with movement, changing positions, drinking water, or resting. They are not a sign of labor, but rather a way for your body to practice and prepare for the real thing. True contractions, on the other hand, are regular, strong, and increase in frequency and intensity over time. They do not go away with movement, changing positions, drinking water, or resting. They are a sign of labor and mean that your cervix is dilating and effacing to make way for your baby. So how do you know if you are having true or false contractions? Here are some clues. If your contractions are irregular, more than 10 minutes apart, and do not get closer together or longer in duration, you are probably having false contractions. You can try to relax, take a warm bath, or drink some water to ease the discomfort. However, if you are not sure, or if you have any other signs of labor, such as bleeding, leaking fluid, or decreased fetal movement, call your doctor or midwife right away. If your contractions are regular, less than 10 minutes apart, and get closer together and longer in duration, you are probably having true contractions. You can try to breathe deeply, walk around, or use some coping techniques to manage the pain. However, if your contractions are very frequent, very intense, or very painful, or if you have any other signs of labor, call your doctor or midwife right away. When should you go to the hospital or birthing center? This depends on your individual situation, your medical history, and your doctor's or midwife's advice. However, a general rule of thumb is to go when your contractions are 5 minutes apart, lasting 1 minute each, and have been that way for at least an hour. This is called the 5-1-1 rule. Some people may use the 4-1-1 rule, which means going when your contractions are 4 minutes apart, lasting 1 minute each, and have been that way for at least an hour. You can choose whichever method you are more comfortable with or which one your doctor or midwife recommends. Remember, every labor is different, and your experience may not follow these guidelines exactly. The best thing to do is to listen to your body, trust your instincts, and communicate with your doctor or midwife. They will be able to guide you and support you throughout the process. I hope this video was helpful and informative. If you liked it, please give it a thumbs up and subscribe to my channel for more pregnancy, childbirth, and overall health videos. Thank you for watching, and I'll see you in the next one.